Good evening, everyone. Today we will discuss about some NCLEX questions for the practice. But before starting this practice questions, here there are some like what are the clinical judgment or what kind of the changes done by the NCLEX from the 1st April 2023 and how to solve the problems by generating the important and the appropriate solutions for the client's problem. So all we will discuss before starting the questions. Okay. So firstly, like what is the clinical judgment, or we can say that how we can define the clinical judgment. So here clinical judgment is defined as the observed outcome of the critical thinking and the decision making. In this, the nursing knowledge is to observe and assess the presenting situations and identification of the prioritized client concern and generate the best possible evidence. So here we can say that like firstly we have to observe the problem. Then we have develop a critical thinking. And then there will be proper decision making. Okay. And in this clinical judgment, we apply our knowledge, nursing knowledge, we can say that, and the skills to identify and assess the presenting situations. And when we observe and assess the presenting situations with the help of this nursing knowledge or the clinical judgment knowledge basic skills, we can identify and prioritize the client concern and generate the best possible evidence. So if there is proper like identification of the disease, then only we can make a best solution to improve the client, like you can say that the condition. So here this is the basic purpose of the clinical judgment, means to observe and observe the client's problem, develop a critical thinking with the proper decision making, and to generate the best possible evidence solutions for the client. Next here, like some major changes in the NCLEX next generation. So you can see that some changes like you can see here, these changes done by the NCLEX from the 1st April 2023. So what are these changes? First is the extended MCQs. Second is extended drag and drop. Third is close option. Fourth is the highlighted items. Next is the matrix guide. So all these 5 major changes done by the NCLEX. So here, first is extended MCQ. So this is applied for the SATA. Select all that apply. So in which in this option there are more than 4 options in the MCQ. Like it can be up to the 6, 7 or 8 options in the MCQ or in the SATA based questions. Okay. So here the extended MCQ. Second is the drag and drop. So drag and drop, what do you mean by the drag and drop? So here like for example, the question is given like risk factors of CVD, cardiovascular disorder. So here risk factors will given. Okay. Like here obesity, here smoking, here genetical history, here gender. Okay. So there will be some like options given, and you have to drag and drop according to the priority. Like you have to mention here only the modifiable. Okay. So now here you have to put the modifiable risk factor. So this is the extended drag and drop. Here the options will also the extended up to the it can be like more than the 5 here, 5 drag and drop options. Next here, close option. Okay. So in close, here it can be like fill-ups or fill in the blanks. So more than one, more than two fill-ups will be there in the close options. For example, here a question, like the nurse is preparing to administer the digoxin to the client, the primary responsibility is nurse to assess here, like one option will be there and second option will be there. So like in the questions, any question will be there and more than one or more than two, there will be the close option. So you have to fill up the appropriate answer here. This is the close. Next is the highlighted items. So it is a simple technique in which like a case study will be given to you. And for example, the ask with the sign and symptoms or some management written purpose that you have to highlight the important items or that are asked in the questions. Next is the matrix guide. It is also the last part of the changes done by the NCLEX. So here like matrix guide, for example, like the finding will be there. I'm giving you a example. Here diabetic ketoacidosis. Here ruptured appendix. And here ectopic pregnancy. Okay. So finding here given like polyuria. Okay, vomiting. Tachypnea. Tachycardia. Okay. So like, for example, here the ruptured appendix, you have to write down or you have to ask about the ruptured appendix and you have put the like findings in the ruptured appendix. So it is the matrix guide, means putting up the correct options into the asked problem. Okay. So here's the matrix guide. So 5 options, extended MCQs for the SATA, more than 6 options, extended drag and drop, close option, highlighted items, and the matrix guide. Next here about like how can we can overcome from this changes or how to solve the NCLEX practice based questions. So here there are some steps. So first step here about the recognize cues. So in first step to solve out these NCLEX practice questions, we have to recognize the cues. And cues are the client finding or the assessment data that provide the information for the nurses as the basis for the decision making to proper appropriate clinical judgment. So here first step to solve out these problems or solve out these practice based questions. So firstly we have to recognize the cues. Recognize means like we have to find out the basic assessment data. Okay, basic assessment data, and it helped to provide the information for the nursing officer as a basic for the decision making to make an appropriate clinical judgment. Okay, because if you weren't able to recognize the cues, you weren't able to make an appropriate clinical judgment. So first step here, recognize cues. So there are some example like cues units of data. For example, the rate of breathing, effective breathing pattern, what kind of the heart rate. So all these are the cues and it helped to recognition in the assessment data of the client. Okay, so first step to find out the basic solution is the recognize cues. Second is to analyze the cues. Now analyze means here the nurse organize and link them to the client presenting clinical situation. Okay, so like we have to find some cues. Okay, then we have to link with client to presenting clinical situation. Okay, so in second step we analyze the cues. Okay, we can make a linking with these cues to find the proper basic clinical judgment. Okay, so here second step is the analyzing the cues. Next here the prioritize the hypothesis. So here in which we prioritize the client's problem or the need. For example, here the client is suffering from anything, like you can see that the appendicitis. Okay, So now you will prioritize the hypothesis, means you will prioritize the client's problem or the needs. Like firstly here the like patient having the fever high grade more than 102 degree Fahrenheit. Okay, second here suffering from the nausea, vomiting, and anything else. So you have to prioritize the client problem or the needs, and you can only able to solve the problems and generate the solution when you have prioritized the hypothesis according to the step by step. So third step is to prioritize the hypothesis. Next is to generate the solution. Now here after the prioritizing all these the problems or the situations or the needs of the client, then we have to generate the solution. Means we have to find out the solutions according to the clinical scenario and according to the priority. There will be some possible action implementation to solve out this problem. Okay. So next step will be there the generate solutions. After generating or finding the solution, our step is to take action. Okay. So what do you mean by the take action? Like deciding which action to implement is to focus the clinical judgment thinking skill. And after generating a list of possible interventions, like I have you explained in the previous step, like generating the solutions, then if you generating a list, and then you can easily able to make a decision like which action to implement, which action not to implement. Okay, like which is suitable for the client. So all these can be possible when appropriate interventions or appropriate solutions you have decided for the client care. So next section will be there the next step will be there the take action. Next here, the step is the evaluate the outcome. So here, evaluate outcome means like all the implementation you have done, all the interventions you have done, then you must be there the evaluations. You have to do the evaluations. Why evaluation? Because evaluation can give us the positive or the negative results. If positive, then we can like find a better measure, and in the negative result we can change the treatment measures, and we can like change other skills, change our medication purpose. So all these can be possible when you will evaluate the whole scenario of the clinical judgment. So last step is the evaluate outcomes. Okay. So this is the basic introduction. In starting, I have explained you like the some changes, like which kind of changes in the NCLEX question. And second, I have explained you about the clinical judgment and how to solve practice questions. So first is recognize cues, second is analyze cues, third is prioritize the hypothesis. Next where will be there the like generate the solutions. After that there is like implementation of the action or the take action, and next last is the evaluate the outcomes. So all these are the basic introduction of this like how to solve the NCLEX practice based questions and what kind of changes we have to kept in the mind when we are solving the 2023 practice based questions of the NCLEX. Okay. So here now, let's start with the first question here. When when caring for a client diagnosed with pneumonia, it is essential for the nurses to gather priority assessment data to effectively manage their condition. Which of the following would be the priority assessment data to gather from the client? Select all that applies. So we can say that here the SATA question. Okay, select all that apply. Now let video like what are the cues. So here cues given like the priority assessment. Okay, so priority assessment we have to find in case of the pneumonia. Okay, so let's see the options. A, auscultation of the bowel sound, presence of the peripheral edema, color of the nail bed, presence of the chest pain, and auscultation of the breath sounds, and blood pressure measurement. So like which kind of the data, like the priority assessment data we have to find in this question. So let's see. Okay. So here, let's start with some basic introduction of the pneumonia. So you can see that here, pneumonia is the inflammation of the lung parenchyma. So here, with the help of this diagram, you able to see, like in pneumonia, this is the normal healthy alveoli. Okay, there is the bronchiole and there are the alveoli that help in the air gaseous exchange. And this is the unhealthy alveoli, means pneumonic conditions, means here alveoli, here the air spaces filled with the fluid. And when there will be the air filled with the fluid, there will be no any gas exchange and there will be the inflammation of the alveolar wall. Okay. So here in case of the pneumonia, like what kind of conditions we have to observe. So let's see. Sorry. Okay. So firstly, we will see here the priority assessment data. So in our first option, there was the auscultation of the bowel sounds. So bowel sounds, I think in the pneumonic conditions, it will not like that much important priority assessment. So we choose the firstly option number C, in which like the color of the nail beds. Okay. So color of the nail bed. So when we can see that there is the cynostic condition will be occur. So in pneumonia, what I have explained you, alveoli filled with fluid, okay, which means there will be interrupted gaseous exchange. So there will be interrupted gaseous exchange, means there is the no any O2 and the CO2 like proper exchange. So there will be deficiency of the oxygen. And when there will be the deficiency of the oxygen, it can lead to the hypoxic condition. Okay. And hypoxic condition means there will be the decreased perfusion, like in the, and what do you mean by the hypoxia? Like it will be the deficiency of the oxygen in all the body tissues. So this condition can lead to the cyanotic conditions. Okay. So it will lead to the cyanotic condition. Cyanosis, you can see that. So cyanosis is a visible sign of the decreased perfusion and the oxygenation. So it can lead to the bluish discoloration, of the like skin, lips, extremities. So here extremities, hands and our nail bed and the hands will be show like this, means the cyanotic condition or the bluish discoloration of the hands. So first priority assessment data, we will check the cyanosis. And how we can check the cyanosis? By observing the skin, lips, extremities, like if there any bluish discoloration or not. So here is the first priority assessment data. Okay. Then second option here, like the right option, you can say that the priority assessment data, chest pain from the pneumonia. Okay. So you can say that the patient will complain about the presence of the chest pain. Okay. So presence of the chest pain is also, like you can see here, important assessment. So how the chest pain? This is also concerned with the O2 deficiency. Okay. When there is a hypoxic condition, oxygen deficiency in the body, then client will take efforts, make efforts for the breathing. So due to this breathing difficulty or the oxygen deficiency, there will be the complaint of the chest pain in the pneumonia. So second option here, the option number D. And next is the auscultation of the breath sounds. So exactly, this is also a priority assessment data that we gather from the client, like auscultation. So what do you mean by the auscultation? Means listening up of the sounds with the help of the stethoscope. So auscultation, you can say that like in the first option, auscultation of the bowel sound. So it is not like a valuable information to gather the data with the auscultation by the bowel sounds. But here, like our option is here, like you can see. Okay. So in pneumonia, the patient will suffer from the wheezing sound. And which kind of the wheezing sound? Low pitched. Okay. Low pitched wheezing sounds will be there. So respiratory assessment we can done with the help of the stethoscope. So what we auscultate, or what we will find, that patient having the pneumonia, having the low pitched wheezing sounds, and that indicate the pneumotic conditions. Okay. And how this possible? Because all the airways, alveoli airways, are filled with the fluid or the mucus, you can say that. So this is not able to exchange the gases between the our lungs. So here, when we auscultate, so no any normal, any breathing sound present there. There will be the low pitched wheezing sound. Okay, so this indicate the pneumotic condition here. Remaining one option, that is the blood pressure measurement and the presence of the peripheral edema. So peripheral edema is inappropriate condition, because it is not a priority assessment for the patient suffering from the pneumonia, because peripheral edema indicate the some heart conditions or the cardiovascular disorders. So remaining the three options will be inappropriate. So here are right options in the color of nail bed, presence of chest pain, and auscultation of the breath sound. All these I have explained you in brief. And A will not there the right answer, because vowel sounds are not a priority assessment for the pneumonia. And presence of peripheral edema is not associated with the priority assessment of the pneumonia, because it may be the priority assessment for the cardiovascular disorders. And blood pressure measurement is also not a specific implementation for the or assessment data for the pneumotic conditions. So right options are C, D, and E. Next question number 2, we can see here. The nurse is providing instructions to the client on the correct technique for using a metered dose inhaler to administer a specific corticosteroid drug. Which of the following client action indicate that the MDI is being used correctly for the given corticosteroid drug? Please select that apply. So what is the cue? Cue is here. Specific information like the metered dose inhaler, and means the question is taking for the correctly, means they are asking for the correct sequence for use of MDI. So let's see in the options. First option is using a spacer device with MDI for improved drug delivery. Second is tilting the head back slightly while inhaling the medication. C, lying supine for 15 minutes following administration, holding the inhaler upright, waiting 5 minutes between puffs, rinsing the mouth after water flowing administration, and tilting the head down when inhaling the medication. Okay, so firstly, before starting this, we have to discuss about the correct use of the MDI in the steps. So here, I'll show you with the help of the diagram. Okay. So first step is here. Keep the chin up and hold the inhaler upright, making sure it is not aimed to the roof of the mouth or the tongue. If available, use a spacer valve holding chamber for the optimal inhalation. Insert the inhaler into the end with the hole and the mouthpiece into end. Okay. Next is here, during inhalation of the medication, tilt your head up. Okay, so you can see here the last option will the tilt down. So down option will be not here. So we will tilt up head. Okay. Next is the start breathing in the slow through the mouth and press down in the inhaler one time. If using a spacer or valve holding chamber, press down the inhaler below you starting the inhaling. Then breathe in slowly to ensure the proper delivery of the medication. We always breathe slowly for the proper inhalation of the medication. Then like using a quick relief free medications. So wait approximately for the 1 minute. Then only 1 minute, okay? So in question there is given 5 minutes. And if you are using the inhaler for a corticosteroid preventer medication with or without a spacer, rinse your mouth with water and split inhaling the larger dose. This helps to reduce the risk, the side effects. And there is no need to lie down or flat after the administration of the medication. And if you require more than one dose, repeat all the steps mentioned above, okay? So this is the correct way. So why I have explained you all these the steps, because these are the correct way to use the metered dose inhaler and how to use the medication. So in the diagram you can see here, see, so this is the metered dose inhaler device. There is a spacer, there is an inhaler, there is the mouthpiece, okay, and this is all the spacer. So here, like you can see that. So firstly, we will remove the cap, okay, and hold the inhaler upright. So you can see here, like this condition, inhaler upright. She have positioned the inhaler in the slightly upward. Then you can either sit or the stand. Shake the inhaler, okay, shake the inhaler, and here you can see press down or release the medication. So you will be the press down and release the medication in this form. Breath up slowly, slowly, okay, and gently or slowly you can breath, and inhaling, continue inhaling for 2 to 5 seconds, and you will inhale only slow, and then hold the breath for the 10 seconds. Why we hold the breath for the 10 seconds? Because allow medication to reach into airways. Okay. And if another puff is needed, then wait for the prescribed interval and okay. And after using the inhaler, like see this diagram, it is very important step at the last. Rinse your mouth with water and spit it out to prevent any potential side effect. Okay, so you can see here this man is spitting out the water after rinsing his mouth. This can help to reduce or prevent potential side effects. Okay. So with the help of this diagram, hope so you able to understand what is MDI and how this can be used and what will be the last step for the MDI inhaling devices. So let's come to our MCQ. So we have we have discussed all the steps in the previous. So here, come to the options. Using a spacer device with the MDI, improved drug delivery. Yes, this will be the right option. Using a spacer device that I have explained you earlier. Then second, tilting the head back slightly. Yes, we can tilt or raise up the head in the upward conditions for inhaling the medication. So this will also the right option. Lying supine for 15 minutes following exposition. So no. So we have explained sorry, we have discussed in the MDI steps, never lying supine for the 15 minutes after the following administration. Next is holding the inhaler upright. This is also the right option. Waiting 5 minutes between puffs. So no, not for the 5 minutes. 1 minute was the right answer there. Then rinsing the mouth after, with water following administration. So it will also the right option, because to prevent or to reduce the potential side effects, and tilting the head down while inhaling the medication. So this will not the right option. So here option number A, B, D and F are the right options. So hope so this MCQ is clear to you. Next question, a 50-year male patient is scheduled for a same-day surgery procedure to undergo a liver biopsy. Which of the following laboratory tests are used to assess the coagulation status? Select all that apply. So it is also a SATA-based question, means patient, what are the specific information here? The liver biopsy. Patient is will undergo a liver biopsy. So which of the following laboratory tests are used to assess coagulation status? Okay, so coagulation status, we have to assess here the coagulation status of the patient. So firstly, what is the liver biopsy? So firstly, pick up the biopsy word. Biopsy also invasive procedure in which we take tissue sample. Okay, and biopsy is the investigation of choice in all cancer. Okay, investigation of choice, or we can say that the confirmatory diagnostic procedure for any cancer. So it will be the biopsy. And what is biopsy? It is an invasive procedure in which the physician take out the tissue sample for the further investigation or to check out the any abnormal growth in the any body part. So here it is biopsy. And liver biopsy, simply the invasive procedure in which the physician take out the sample from the liver. So next is main here, like which of the following laboratory tests used to assess the coagulation status? Means we have to assess the coagulation status of the client before the biopsy. So like here, hemoglobin, what are the options? Hemoglobin, platelet count, complete blood count, white blood count, prothrombin time, partial thrombin time, serum electrolytes level, and the urine analysis. So let's see. Coagulation studies. So in main coagulation, okay. So coagulation studies for the liver biopsy. Firstly, we will choose the platelet count. So why the platelet count? Okay, so I'll explain you here. But before starting this platelet count, one thing I want to clear. In the coagulation studies, the important things or the we have to assess in the client here. Prothrombin time. Okay. Second is partial thromboplastin time. Third one here, thrombocyte count. These all three are the most important coagulation studies. So let's discuss them one by one. Okay. So firstly, the platelet count. Platelet count is the main important component of our blood. It involved assessing the quantity of the platelet presenting in a blood sample. So like why we check always the platelet count? To check out the any bleeding disorder. Okay. Any bone marrow disorder. Okay. So this just plays a vital role in evaluating overall health. Okay, that is related to the specifically platelet count. So before biopsy, to check to check out the any bleeding disorder, we can use to do this investigation, that is our platelet count. Second is our prothrombin time and activated partial thromboplastin time. So let's start with the prothrombin time. Here you can check. See the prothrombin time. So prothrombin time is a commonly performed blood test in the clinical practice to assess the coagulation studies. So it is primarily utilized to evaluate the extrinsic and the common pathways of the coagulation. So if we check the prothrombin time, we can check the clotting factors deficiency. Okay. Factor number 2, factor number 5, factor number 7 and 10. Okay. So that we can check the coagulation process of the individual. So that's why the second step is to check the coagulation for the coagulation study prothrombin time. Okay. So prothrombin time in which we check the clotting factors deficiencies like clotting factor number 2, 5, 7 and clotting factor number 10. And this will help to evaluate the coagulation process. Next coagulation study here about the activated partial thromboplastin time, or we can say that the PTT. So here it can also check the coagulation process, in which we have to evaluate the intrinsic pathways. Okay. So here, 3 important coagulation studies we have to assess for the laboratory purpose when patient is undergoing the liver biopsy: platelet count, prothrombin time, and activated partial thromboplastin time. Okay. So now back to the question here. So right options we have discussed be platelet count, our prothrombin time, and partial thromboplastin time. Okay. So let's have a vision on the all these remaining options like the hemoglobin. So hemoglobin is not the priority or the important coagulation status assessment data. And WBCs, you know, the WBCs, so it will be not the right option here. And WBC here, white blood cells. So white blood cells are WBCs for assessing the infection process. Basically the inflammation. Okay, that's why we use the WBC, because it is a valuable tool for screening the diagnostic conditions where the quantity of WBCs in the bloodstream is low, like in the infection process or anything, inflammation, any disease regarding the WBC. So it will also not plays any role in the coagulation study. So this will not an appropriate option here. Next here, the electrolytes level. So electrolytes here, like the fluid or the electrolytes. So all these are only helpful when we have to assess the electrolyted imbalances. So imbalances can affect our vital organs function. So this will also not play an important role in any coagulation status. So this will also not an option here. And urine analysis, the urine analysis will able to detect out the some chemical, microscopic, and any physical properties of the urine. So it can valuable for the like all the overall the health status for the client, but this is not plays an important role in the coagulation study. So all these irrelevant options, and our right options will be here: the platelet count, prothrombin count, and a partial thromboplastin time. Question number 4 here. The patient is admitted to the hospital for evaluating a potential polycythemia vera. Which of the following symptoms are indicative of the diagnosis? Please select all that apply. So here condition is given as the polycythemia vera, and we have to find out the symptoms that are indicated of this diagnosis. So it is also a starter based question. So options given: excessive sweating, headache, hypertension, prolonged clotting time, polyphagia, weight loss, fatigue, muscle cramp, and the pruritus. So let's have a check on its theory. So you can see here, firstly, what is the polycythemia vera? So polycythemia vera is one of the related group of the blood cancers known as the myeloproliferative neoplasm. Too many red blood cells are formed in the red bone marrow. In many cases, the number of white blood cells and platelets are also elevated. So means you can see here the polycythemia vera is a condition in which there is overproduction of red blood cells. So it is a disorder characterized by here the excessive overproduction of the RBCs and leading to elevated hematocrit levels, increasing the blood viscosity. So like there are some basic symptoms here. So you can see here the comparison, some more common symptom and some less common symptoms, like elevated hematocrit level, elevated hemoglobin level, urethra, pruritus after bathing, splenomegaly, weight loss, weakness, sweating. And in the less common here, the bruising, epistaxis, erythromyalgia, hemorrhagic events, hepatomegaly, ischemic drugs, okay, TNS, atypical chest pain, hyperemic inflamed condition of the extremities. So these are the like in the comparison way, the more common symptoms and the less common symptoms. So here, and some over like fatigue, headache, dizziness, episodic blurred vision, peripheral tingling, hypertension, mucosal cyanosis, bruising, petechiae, and large spleen or the liver. So like how we can identify or how we can prioritize the symptoms that are indicated of these all the diagnosed. So let's come to our question. Okay. So let that I have explained you some symptoms. So like headache. Next is here. Yes, hypertension, prolonged clotting time, and here pruritus. So these four options are the right option: B, C, D, and I. Okay. So all these are the important symptoms that are indicative for the diagnosed polycythemia vera. And some remaining like the weight loss or muscle cramps, fatigue. So these are not the common manifestation of the polycythemia vera. So we can't consider it's the indicator for the diagnosis of the polycythemia vera. And here there is some cardiovascular also effects. Also the cardiovascular effects here, like elevated hematocrit lead to increased viscosity. Okay. So if the viscosity will increase, means increased blood volume, and that lead to some condition like the thrombotic condition, altered coagulation process that lead to prolonged prothrombin time. So this is the reason like how the prolonged clotting time and hypertension, because increased viscosity and increased blood volume. So when blood volume will be increased, there will be increase in the cardiac output. Okay, so cardiac output increase means the hypertension, and the headache is the classical symptom of the hypertension. So it can also the symptom of the polycythemia vera. And here the pruritus condition. So like pruritus condition that develop due to how can be the like patient suffering from the pruritus. So actually pruritus condition develop to the excessive accumulation of the some uric acid throughout the skin, and uric acid lead to the itching and the non-uric conditions. So here option number I is sorry, last is the right, pruritus. So all this clear like how this condition, because there are the two main concept that we have to uh, know about in the polycythemia vera, that is elevated hematocrit and increased viscosity. So hematocrit will be elevated, viscosity will be increased, viscosity will increase in the blood volume increase, patient's cardiac output increase and suffer from the hypertension. And the classical sign and symptom of the hypertension is like the headache, occipital headache. So here option, and it can lead to the thrombotic conditions, means the prolonged clotting time, and that can lead to the also lead to the pruritus due to the excessive accumulation of the uric acid component over the skin. So this is the main symptom that are indicated for the diagnosis polycythemia vera. Okay, so next and the last question here. The nurse is providing education to a client that has been diagnosed with the polycythemia vera, a condition characterized by the abnormal increase in the number of red blood cells. The nurse wants to inform the client about the potential complications associated with disease. By understanding these manifestations, the client can be better prepared and take appropriate measure to manage their conditions. And please select all the apply manifestations that the nurse would include in the client teaching plan. Okay, so in which wait, okay, so in the question is asking here like potential complications and the major manifestation that patient will suffer from the polycythemia in the polycythemia vera. So as I have explained you earlier that the polycythemia vera is a condition in which there is excessive overproduction of the red blood cells. So when there will be the excessive overproduction of the red blood cells, you know, okay. So let's have an overview again of the polycythemia vera. So firstly, you can see here, okay, it begin with mutation of hematopoietic stem. Okay. And most of the individual suffer from polycythemia vera due to mutation of genes kinase gene, JK gene. Okay. So see here, like the manifestation that I have explained you earlier, but here and in normal the overproduction of red blood cells. So see here in which there is increased hematocrit value. So if there will be increased hematocrit, so it refer to the proportion of the red blood cell in the total volume. So you can see here when there is an increased hematocrit, it can altered our flow of circulation. Okay. So condition develop here, hypervolemic condition. Due to the excessive fluid in the blood. So hypervolemic condition you can see here. So it can lead to increased total blood volume. So first condition is here, the hypervolemic shock, or it is only possible with the only increased hematocrit value. So first condition is this. Second here. Secondly, due to the increased hematocrit, there will be increased hyperviscosity. Increased viscosity, sorry. That lead to, we can say that the hyperviscosity. It lead to thickening of blood volume. Thickening of blood. Okay. And when there is a thickening of the blood, it can lead to thrombus or clot formation. Are you getting me? And when there is a thrombus or a clot formation, it can lead to various complications. And which kind of the complication? Like the stroke condition, damage. Okay. And due to this hyperviscosity, there will be some symptoms like fatigue, weakness. Okay. Headache. Dizziness. Shortness of breath. Visual disturbances. Bleeding. Okay. So bleeding you can see here, like it can be the heavy menstrual bleeding or bleeding from nose, that is epistaxis, etc. Okay. And increased clotting time that I have explained you in the previous question. So these all symptoms are due to the hyperviscosity. Okay, here. So this is the concept of the hyperviscosity, increased hematocrit. Third concept here, like There is a one symptom also seen in the polycythemia vera, that is increased uric acid production. So when there will be the increased uric acid, that can lead to increased uric acid level, and that can lead to the accumulation of uric acid joints, and that can lead to the gout condition. Okay, so here there are some specific conditions and the complication I have explained you. Rather than this, fourth one is the hypertension, and you know how the hypertension, it can also with the like increased blood volume, because increased hematocrit lead to the increased blood volume, and that lead to the increase our cardiac output, and the cardiac output can lead there is the increase our blood pressure. So all these are the symptoms. And here we can say that some in the polycythemia vera, when the blood will be the thick, one logic is also here, when the blood is thick, so that can lead to the damage of various organs, and the damage occur. So like some symptoms occur, the fatigue, weakness, headache, dizziness, shortness of breath, visual disturbances, epistaxis, heavy menstrual bleeding, bruising, etc. So here I have explained you all the concepts related to the polycythemia vera. Now you will easily able to find out the right answer here. So here, firstly, the right option is our gout. Why gout? Because gout due to the accumulation of the overproducted uric acid. Second is here dizziness, headache, visual disturbances, and our orthopnic condition. So here C, D, E, F, and H are the right options. Here the one option, the orthopnea. Why the orthopnea will be occur here? So it is we can define that it is the shortness of the breath and breathing difficulty when the lying down. So increase, it is also due to the increase our clotting time. When clotting time will be increased, there will be a client may experience some cardiovascular and the respiratory manifestations. Okay, so cardiovascular manifestations lead to the orthopnea, which means a difficulty in the breathing while the lying down.